Hello, everyone, and welcome to episode 3 of the Air Exchange. It's my great pleasure today to have our esteemed guest, Dr. Sharmila Kudav Mudgal, who is here to speak a little bit about air pollution and public health with us today. So, Dr. Mudgal, thank you for taking time from your very busy schedule to be with us.
Thank you for having me, Bruce. I'm looking forward to this chat.
Well, I thought I would begin by just sharing a little bit about your background, a little bit of a bio, and then you can feel free to fill in anything that I've missed there before we get into some questions. So Dr. Mudgal is a physician entrepreneur with a passion for developing business-based solutions to solve public health problems. She is board certified in occupational and environmental medicine and has over 25 years of experience in working in clinical as well as industry and startup environments. Currently, she serves as the medical director for Venus Safety and Health, which is a leading filtration and respiratory protective equipment company. Anything else that I should add there, Dr. Mudgal?
No, I think you've pretty much captured my background, and I think I'm ready to get started with this chat.
Okay, great. Well, first off, it's exciting as we typically talk about indoor air quality and the intersection of air quality and public health to actually have a physician to talk with today. So maybe to start with, I think that the term environmental health is quite interesting. And actually, as a discipline, I was curious what environmental health is versus other disciplines of medicine. If you could share a little bit about that and how that's informed your background.
Sure. So a little bit more about how I got into environmental and occupational medicine. My background in clinical training was a very specific training to treat diseases of the individual. And my first exposure to actually occupational and environmental medicine came when I got my master's in public health with the focus on epidemiology and biostatistics. So this is something that really helped open my eyes as to how, as a physician, I could actually impact the health of populations. That includes individuals, their families, as well as communities. When I got exposed to the specialty of occupational and environmental medicine, it's a training program that physicians go through, which is a residency and a fellowship training, during which they learn how to manage but also prevent injuries, illnesses, and disabilities. And it really opened my eyes to the fact that in addition to treating patients one at a time, I could actually look at the health of communities by identifying systemic factors that actually play a role both in maintaining health as well as in causing disease. Right. So when you look at environmental health, our environment is very, very a part of our lives. It actually shapes how we interact with everything around us, the air, the water, even our workplace environment, which sometimes may have poor air quality or toxic chemicals, depending on the types of jobs we do. So when I did my further training in environmental medicine, I realized that it was actually a multidisciplinary collaboration of individuals. So it wasn't just physicians, it was toxicologists, it was environmental health professionals, industrial hygienists, epidemiologists, researchers, and a whole community that brought their experience and their expertise to sort of dwell on what is it that keeps us healthy and what is it that makes us sick. So when we start to think about complex problems, it really requires that multidisciplinary collaboration. And this particular specialty looks at everything in a very holistic way. So because it's a complex interaction, it's not enough to just look at it from one aspect. You have to sort of really consider, what is it that is around us? Is it, is there a specific level that makes us sick? Is there a specific level that we need to have regulated? We also sort of focus more on a prevention-based approach. Because if you try to treat every individual that gets sick from their environment, there aren't enough doctors in the world to treat these problems, right? So we really have to focus on identifying these systemic risk factors and then focus on treating them. Because it's an interdisciplinary collaboration, you have these environmental risk assessment specialists who look at identifying what are the toxins that are problematic. They also study how these enter or interact with humans. How does it get into our body? What does it do when it's inside the body? What are toxic levels? Is this something we can monitor? Is this something that we can mitigate either through drugs or chelating agents, sometimes in the case of toxic chemicals and other substances? And I think a crucial part of this is also that it requires us to sort of then take all of these findings to policymakers and advocate for some sort of mitigation strategies. So in a nutshell, that's how I would define it.
It's very interesting, and of course with environmental inputs, there's so many things that can affect our health. We know that air pollution is certainly one of those things, and in a bit I wanted to get into the recent wildfires in Canada and how that's impacted some of the Northeast and some cities that in the past have not dealt with these large smoke plumes that we've seen recently. But just in general, is it possible to share a little bit about how you see the health impacts of air pollution, really as an issue for society? And I know that, and we'll also get to this a bit later with your company, Venus, which is headquartered in India. You have a lot of experience and understanding about how the environment can really, as relates to air quality, can really be impactful to health. But can you share some thoughts on the intersection of air pollution and public health, and maybe how that relates to medicine or the medical profession in the U.S.?
Sure. That's a lot of questions, and I'm going to try to answer them one at a time. So you brought up the whole the wildfires that we recently experienced in the northeast of the United States, and the fires actually weren't in our area; they were in Canada. And it sort of made people realize that even though we think about the environment that is local to us or our microenvironment, we are actually all connected, right? The air that we breathe, and we breathe up to 12 plus times a minute, almost 6 liters a minute. It's coming from multiple different directions, depending on the weather, depending on what's happening, not just in our area, but also regionally and internationally. So when the wildfires happen, I think we all experienced, especially in the New York area, that the air quality became really poor. And there were reports, and I wasn't in New York, but I saw the pictures where you could barely, the visibility was poor. You could see the haze, you could see the smog. When that happens, I think people instinctively understand that there's a problem, right? But air pollution isn't necessarily only what you see. It's also about the invisible parts that you don't see on a regular basis. So if you look at the wildfires again, the smoke, the fog, and everything that it carries down, depending on the weather conditions, can reach multiple parts of the country, as well as other countries as well. So when we look at air pollution from wildfires, we look at particulate matter, which we look at as 2.5 microns and below sizes. We also are concerned about other noxious pollutants, ground level ozone. We're looking at sulfur dioxide, nitrogen dioxide, carbon monoxide, as well as volatile organic compounds. And depending on the area that's burning or the vegetation that's burning, you're going to see a whole lot of other noxious chemicals as well. And that can change from area to area.
So it's interesting. Oh, I'm sorry. Yes.
No, go ahead. Go ahead.
Oh, I was going to say it's interesting. I think that majority of the population is not as familiar about what specifically the dangers are of wildfire smoke versus allergens or, let's say, auto emission pollution. And so I was curious, if there's an explanation that you could kind of provide or share, and if that has a particular impact or health outcomes versus other pollutants that are in the air. How dangerous really is wildfire smoke versus other pollutants?
Right. So I would say that air pollution in general is something. It's not a new problem. We've been experiencing this for thousands of years, and but our understanding has been shaped by technology, by a deeper understanding through research and data that we are now able to access. So when I look at air pollution normally, I think about what the Clean Air Act, which was based in 1970, it set some standards and it looked at 5 pollutants, right? It looked at particulate matter, it looked at ozone, sulfur dioxide, nitrogen dioxide, as well as carbon monoxide. And when we want to look at air pollution on a regular basis today, by accessing technology, we have alerts that we get based on the air quality index, which tells us what our exposure is on any day to day. But in addition to that, when you look at a specific situation like wildfires, it's much more complex. In addition to these pollutants, you're also exposed to, like I said, volatile organic compounds, and then depending on what the vegetation is, you can get polycyclic aromatic hydrocarbons, benzene, formaldehyde, all of these type of chemicals. And our body is not equipped to breathe this toxic all these chemicals into our body and stay healthy. So it's really important to sort of be aware of what's going on around you. It's important to consider not just, on a day-to-day basis what you're doing. So we in the clinical world, especially, we are very careful about telling our patients that, hey, monitor the air quality. And if you're a fitness fanatic who likes to be outdoors, check these parameters and try not to exercise strenuously when these sort of conditions exist. And if you must, try to find the time of the day when it's less. Like if there's a wind blowing, it's a little bit better than if the air is stagnant. Also, we then also want to tell people that they should really wear either a protective mask or something to sort of prevent inhaling all of these substances into their lungs.
Well, that's something you also know quite a bit about, both as a physician and in your role with Venus. I'm curious, though, Doctor, the situation with exposure outdoors, we know, can be quite significant, and I think because people can see and almost feel, it's almost visceral, the pollution with the redness over the horizon and really seeing it. I know a lot of the directives that were coming through media was stay indoors and keep your doors and windows shut, implying that would be safer and not having exposure outdoors is safer. But we also know outdoor air can get indoors, and sometimes without proper ventilation and filtration, indoor air quality can actually exceed the pollution that's outdoors. In the recent bout of wildfire, did you see any situations where people indoors or outdoors were, having symptoms, things like asthma, exacerbated, or any uptick in visits to ERs or to physicians?
Yes, and I'm going to give you a personal example. So I do have mild asthma COPD complex, and I also like to exercise outdoors. So when I sort of saw the conditions that were happening, although we ourselves didn't have an extremely poor air quality index at the time of the wildfires, I did notice that when I went out and I was running outdoors, that I started to experience some chest tightness. And so for people who have these underlying conditions, there are certain things that they should be aware of, that they may experience a number of different health conditions. They may experience some eye irritation, redness, watering of their eyes, upper respiratory irritation like a runny nose, sometimes rashes. They may experience chest tightness, some wheezing, maybe coughing, and some people, depending on their underlying condition, may also experience some weakness or fatigue and other symptoms as well. So it's really important for individuals to consider their underlying vulnerability, their medical conditions, and sort of educate themselves a little bit about how they respond to these type of conditions. In addition, I think we also always have to consider vulnerable populations like the elderly, children, pregnant women, right? Their physiology is a little bit different and they react differently. So it's really important for people to consider advice that is sort of tailored to these populations as well.
Yeah, that's great advice. And again, just because I'm in the filtration industry, quite often I'll have conversations related to filtration, and there's a lot of interest with just friends and family around how good of a filter are our lungs. And of course, that is a line of filtration. But I think what's commonly something I've come up against is this belief that particles sort of stop there and you can either cough them out, or perhaps that's going to be something that, will cause you issues, could turn into asthma or something more serious as a pulmonary issue. But the fact that some of the fine particles can actually get into your bloodstream and cause inflammation, that's when people get concerned that aren't aware of that. So are there any specific concerns with prolonged exposure as far as particles, not just from a pulmonary standpoint or impact on your lungs, but actually getting into your body, into your bloodstream?
That's a very good question, and I'm glad you brought it up because I think the human body is amazing. We have a number of defenses that actually protect us from many environmental pollutants. And when we breathe in, if you're a nose breather, there are these hair inside your nose that actually help filter out and catch large particles. So they trap these. Then as the air goes down through your trachea and down into your lungs, there's additional mechanisms that sort of, if we get foreign bodies in, it can trigger coughing and help us to expel whatever the particles are with the mucus that's generated. But what is less well understood is that the fine particles, which we refer to as the PM 2.5, they are really fine and they escape through all of these defenses, and they can penetrate pretty deeply into the lung. By which I mean that they escape, they go into our bronchioles and the alveoli and can trigger different reactions. So by their very nature, they're inflammatory. They cause what we call oxidative stress and trigger inflammation. And this can have an impact on not just your respiratory system, but it also can impact your cardiovascular system. It can impact other systems, get into other organs besides the heart, besides the lungs, I mean. And over the long term, it can cause many different diseases. There is pretty clear scientific evidence that air pollution can cause multi-system diseases, but most people think of it as purely affecting the upper airways or the lower airways. And I think that there needs to be more education regarding this matter, that we have to be concerned about other diseases as well. In addition to the diseases that we are familiar with, there are questions about what happens to vulnerable populations, as I mentioned, with children, with the elderly, and with pregnant populations. Those populations can experience things that are very different from the general population, purely because of their healthcare vulnerability. So we have to be sensitized to those populations as well.
Yeah, it's very interesting as a topic, and a little tidbit there is it sounds like you were maybe recommending we breathe through our nose. Is that the better way to breathe in air versus our mouth?
It is, but I think it's something that it's multifactorial, and if you're used to breathing through your nose, it's better you breathe than not breathe.
Fair enough. Well, one thing I wanted to touch on related to health, and then maybe we can move on a little bit to your role at Venus and some other questions, is, and you touched upon it, I think, quite often I've come across statistics from the World Health Organization and other governing bodies that study the impacts of pollution and the health impacts, and have seen a number frequently around 7 million deaths per year attributed to air pollution, and you may not have the answer for this, but I've always been kind of curious since pollution could effectively create inflammation and show up as different things in your body. I wondered if that, how they're arriving to this number of 7 million fatalities a year, and if you had any insights into that, or if if we think maybe those numbers could be different as a result of the fact that maybe lifestyle and different things are kind of being looked at as the reason you have a certain ailment or illness, but could it be air pollution that's not perceived as such? Any thoughts on that, or those numbers?
The numbers themselves, I think, tell a story that I believe, and this is my personal opinion, is a conservative estimate. As we discussed earlier, environmental health is a complex subject. It has by its very nature, it's something that is very difficult to quantify, right? So when you're looking at the way that these multidisciplinary people study environmental health, its impact on populations, they're looking at there are many different ways of looking at it. One is that you look at the acute health effects of air pollution, and then you look at the subacute effects or the chronic effects of health pollution. So typically when you're looking at it as a researcher, when you want to make an association or a causal association between the effect of a risk factor and a health outcome, you have to be able to quantify that risk. You have to be able to measure it. You have to be able to show that there's a direct link between that particular risk factor and the health outcome, right? So when there's a very simple way to measure that risk factor, it's easy to quantify it. So for example, if you trip over a wire and happen to fall and break your leg, there's a very direct causal effect. But when you look at the air that we breathe and you look at the variations in the air quality that happen on a day-to-day basis, it's really difficult to measure it. It depends on where you were at a particular time, not just you. When we're looking at the health of populations, we have to look at a large sample size, and everybody has their own different level of microenvironment, the air that they're breathing in. So as you can imagine, it's very difficult to quantify the risk. Right, and sometimes it's easier to quantify an acute risk versus a chronic risk, because we're not static people. We're moving around. We have our personal activities. We're exercising. We're indoors. We're outdoors. How do you actually draw attention to that risk factor? So because of the very complex interaction, it is very difficult to. Not impossible, but it's somewhat difficult to sort of draw a direct link and say that this happened because of air pollution. So therefore, these estimates are conservative estimates, and but I think it's based on certain natural experiments that we've had. COVID, as we all know. There was a global cessation of human activity. There was industrial activity stopped, and we all saw that, especially in India, where I was when COVID first started and a huge global lockdown happened, that the skies became blue. That was very unusual, right? I mean, during normal times, it's gray, it's dull, there's smog, there's fumes, all sorts of things. And so suddenly all the cars were off the road, skies became blue, and people themselves noticed that their health seemed better. They felt
Right.
better when they were breathing cleaner air. They noticed that they were not having as many exacerbations of asthma or COPD, or, generally everything just seemed to feel better. And so I think that natural experiment tells us a lot, even though we couldn't quantify it at an individual level or the health of communities and populations.
Yeah, that's a great way to communicate it. It's kind of qualitative. It's hard to get a real quantitative read on what the environment is doing specifically all the time to our health. But sometimes we can tell when we see things like that impact of cleaner air. Unfortunately, it was the pandemic that in some respects made us slow down. But that's a kind of a good segue. I'd love to chat a little bit about Venus, and maybe you can share just about the company, any relevant history, and your role. I know that now you are medical director and also in charge of America's operations. So I'd love to hear a bit more about Venus and the background of the company, its origins.
Sure. So Venus was founded by Mahesh Kudav, and he has a very interesting story about the founding of this company. He was about 19 or 20 years old, with a degree in chemistry and interest in technical textiles, and wanted to do something with textiles, and he happened to sort of think about making masks at the time. Now, this was India in 1986, and you have to think about how different things were then. The level of education, or the level of understanding and awareness about personal protection was very rudimentary. So think about starting a company, making masks, and then having to sort of develop a market for it. Typically,
Right.
when you make products, you're trying to solve a problem that already people know exists, right?
Right.
So when he started the company, he actually had to go out and create a market for it and develop awareness around it. So the company developed a very solid foundation in educating the public, raising public awareness of occupational and environmental risk factors, and then developed an expertise over the years in advanced technical textiles and providing respiratory solutions. So fast forward from 1986 to now, and we have a well-developed expertise in providing respiratory solutions, from simple masks to very advanced respiratory protection.
Fantastic. And how do you see your role as unique with your background as a physician as well as being an executive with the company?
So it's an interesting role, and making the transition from a clinical role to a product company, the way I look at it is that when I was on the clinical side, I was treating patients that were exposed to risk factors. And I often wish that I could provide them with protection and and help to sort of design programs that would prevent all of these problems we saw. So I often go back to the NIOSH. Everybody's probably familiar with the inverted triangle, which comes from the prevention through design. The inverted triangle has 5 factors, and we often in clinical practice, or when we work with industry, we talk about when you identify risk, you either want to eliminate it or substitute the hazard, or use a variety of engineering and administrative controls to reduce the hazard. If all else fails, then we sort of resort to personal protective equipment. So in practice, it should be the last resort. It should be something that we use only when everything else fails. But when you look at the systemic risk factors and environmental pollution, both here as well as globally, I think that it's going to take a very solid effort from everybody to be able to control this. So in the absence of those type of controls, I decided that I wanted to really focus on developing products. I wanted to really look at not just personal respiratory protection, but also looking at the health of indoor air quality, and so looking at filtration products. So when we look at developing or bringing about innovative solutions, we look at innovative filter media, going from your very traditional media to synthetic media, to anything that would actually make these products that are very efficient, very comfortable for people to use, both in their personal protection as well as in their buildings, to improve the ventilation of their indoor spaces and protect them. Also, we want to be cognizant of the fact that these are expensive products in the long term, and so how do we sort of bring about innovation that makes these affordable to everybody? So that's my primary focus at this time.
Fantastic. Well, again, it's quite unique that you bring the background you do to the industry of filtration. And maybe it's a good time to just ask if there's anything that we haven't covered that you would want to share with our listeners related to the intersection of air quality or environmental wellness and public health.
Oh, I have a lot to say. I think as a clinician and as a public health professional, and now as someone who's involved, deeply involved with product development, I like to tell people that your health is your responsibility, and so it's not enough to sort of acknowledge it, once in a while. It's something that we all have to take control of. We have to sort of educate ourselves and get aware of what is around us. We really want to make sure that we are able to detect these changes in our air quality, and sort of everybody has a personal responsibility to sort of be part of the solution. And I do believe that it's one of the things that motivates me every single day, that I would much rather prevent illnesses than to be treating illnesses. And to that, we require everybody's participation, and not just visiting the doctor when you're sick or experiencing a problem.
Well, thank you very much, Dr. Mudgal. I appreciate your being here and really enjoyed our conversation and your insights. So thanks again for being on the Air Exchange and taking the time to join us today.
Thank you so much, Bruce. I really enjoyed talking with you.
And thank you to all of our listeners as well. If you found today an interesting conversation, if this episode is something that you think would be interesting to others, please do share it. And as always, we'll look forward to your joining future episodes. And until then, I am your host, Bruce Larange, wishing you happy and healthy breathing. Thank you.